15, the first to report on the plan for how people could get vaccinated in Arizona. State health leaders submitting their draft to the CDC. And while we all wait for word on when a vaccine will be approved.
And tonight we do have exclusive insight from Arizona's former director of emergency management on what we should be asking and what this plan means for you and for your family. Our Nicole Gregg's in Phoenix tonight. She was the first to receive a copy of this plan.
Several sources tell me that key officials have not seen these documents. They tell me that a task force and county health officials did not see exactly what was submitted to the CDC.
And so many of us have already applied.
Dr. Andrew Carroll, a local family physician, wants to be one of the first to give out a COVID-19 vaccine. He's submitted his paperwork.
We've completed all of that. So now we're just waiting. We're waiting to hear which vaccine will get approved, which one will get distributed, and then whether or not we're going to be one of the primary sites to deliver.
This is the 52-page plan that details who would receive a vaccine first. Healthcare personnel are at the top, followed by other essential workers like teachers, people with health risks, and those in long-term care facilities. Up next, at-risk populations like minorities, tribal facilities, and those in prison or homeless.
They have conducted one tabletop exercise.
ABC 15 with exclusive insight from the state's former director of emergency management, going through the plan with us, pointing out important details like how the state is doing exercises on their plan.
They're conducting another one at the end of the month. So it would be interesting to hear and understand what the outcomes were from that exercise. What did they learn? And how did that feed into making some updates or changes to this draft plan?
The draft plan also details how the state is starting to onboard providers that would be part of giving out the vaccine. This map shows the 500 providers who have completed the onboarding process. They're mainly in Maricopa and Pima counties.
It was really those that had completed the process. So there are many others that are still working through that process.
And another big takeaway is the meticulous process for providers to be a part of the first vaccine. There are strict requirements for extreme shipping and storing them. Dr. Carroll will have to show proof of equipment and pictures of certain freezers to keep them stored.
We do have the equipment to deliver most of the vaccines. The only concern we have is about whether or not the vaccine may require ultra low temperature freezers. And we're in the process of acquiring one right now.
As for when will we see a vaccine, the Department of Health tells us that the CDC has told states that we could see a vaccine, the first doses by the end of the year. Reporting in Phoenix, Nicole Gregg, ABC 15, Arizona.
Nicole.